Hi everyone, this is Dave and Pat from Living the Creative Lifestyle. Actually, it's from Wake Up for Your Health. And we just wanted to tell you a little bit about what's happening in our particular circumstances. We were supposed to be flying home from California on Thursday from an airport in California, the San Jose airport, which is not really a great place to be at right now, into JFK in New York, which is not a good place to be into right now because of the infection, and then to Florida. So we decided that for our health, we've waken up for our health, that it's not a good idea to do that. So we've decided to postpone our trip back home for another 3 or 4 weeks and be very, very careful so we don't contact this COVID-19 and keep ourselves in good health.
Yep, because we don't want to spread it either to anyone else. And we're not really sure, but there were two people in this household that were sick with colds. We never were tested because that was earlier on, and even the test kits apparently weren't approved by the World Health Organization. So nobody knows a lot of the facts and a lot of the details, but we just know what we are doing, and we're being very careful. We're self-isolating, and we are keeping our distance, except Dave and I are pretty close very often, and are looking after ourselves, doing meditation on a daily basis. And if you aren't doing that to keep a positive frame of mind, we would recommend Jay Shetty's meditations daily for 20 days. They're excellent, and that's what we're doing for ourselves. And we're trying to keep up to date with what's going on, not so much in the news, because we know that sometimes the news isn't always quite correct. And we know a lot of things that we listen to, we don't know for sure what is correct. But we did listen to a couple that told their story about when they were diagnosed with the virus. And their story is their truth and their facts. And it's very, very interesting. And I think that the experience is the best teacher anyway. And for them, they were on a cruise ship. And of course, they were put all into isolation and into their rooms. And they gave everyone on the cruise ship a thermometer. And they were isolated and they were told, if they had a temperature that went over, I think it's 37.5, but don't mark my words there, that they were to notify the health person on board. And so they were supposed to take their temperature 3 times a day. And of course, this fella, David was his name also. David and Sally, you really need to check them out on YouTube. He said that they took theirs about 10 times a day. And of course, after a bit, his did go up over that amount. So they did contact the person on board and they were diagnosed with the coronavirus. So they were on the cruise ship and got off in Japan and were treated very, very well with 2 different hospitals in Japan. And his story and her story is just so interesting because the testing everywhere is different. Our one daughter works in Emerge, and she was telling me how they tested their hospital, and then the coronavirus test kits weren't approved by the World Health Organization. So I'm wondering if some of you can just tell us what you know about how they are testing in your area and where you're from, because we find it very interesting that this is a worldwide disease and it's not being tested in the same manner. But the symptoms are much like a very bad cold. And we've been listening to all the positive things that we can listen to also. The negative ones are out there too. And if you want to frighten your children or your neighbors or anybody into staying at home and self-isolating, you could let them watch one of these movies. What have we got? Containment is one, outbreak is the other. Either contagion or contagia, and pandemic. Those would be enough to scare the life out of people to stay at home and keep their distancing. That's not what we want, but that's what we've got lots of, and some people are still not listening to what we're supposed to be doing and self-isolating. So sometimes we need little things like that to help people realize that it is a virus and it is spreading. But what we do need to do is get people meditating and get a better frame of mind, because we know when you're happy that your immune system works better. When you're stressed out, your immune system goes way down, and that's when viruses are going to catch you more likely than not. And this morning we listened to a very, very interesting speaker, or actually it was a letter that he had written to
Well,
President
it was a
Trump.
video that he did for President Trump to listen to. And it was all about him finding a way that he could treat people for this coronavirus. And he treated 350 patients with this. I'll have to read that because
zinc and an injection of a malaria treatment that they used years and years ago.
It's called hydroxychloroquine and zinc vitamin.
So this is just what we've learned.
Mm-hmm.
Tell them the doctor's name.
His doctor's name is Dr. Vladimir Zelenko from New York, from Orange County, New York. And he has treated 350 patients using this hydroxychloroquine and zinc. And his treatment results in the shortness of breath issue was resolved within 4 to 6 hours. And Dr. Zelenko in his study had 0 deaths, 0 hospitalizations, and 0 intubations.
So he did that all from home. The people were all at home, and he did that just talking to them.
He treated them at home or in an outpatient setting, not in the hospitals. Mm-hmm. And he's saying that's a big thing because the hospitals are overwhelmed and there's shortness of supplies and ventilators and all that stuff. So this is a way of doing it as an outpatient.
And we like to hear that because our one daughter's an emerge nurse. And when they told them the other day to cut back on the masks and the gowns, it was very frightening for the staff, very frightening. And I just don't feel that that's necessary to put everyone's life in jeopardy. If we have a disease that's contagious and going to cause a death, like, stay home, help everybody. We're all here to help each other, prevent the problems, and get life back to normal if possible. I can see lots of good things happening, though, since this all happened. Families are working together. They're playing together. Kids are cooking and they're helping with the cleaning. They're getting online to do their studies, which is an awesome thing because then they have control over their time and their life. Mums are homeschooling, which is difficult for some mums because some of them are still trying to work also, and that's like a full-time job. Our one niece homeschooled 5 of her children, and we're so proud of her that she had done this before she had to do it, whereas now mums and dads, they're forced into doing it. They have to if they want to get the education ongoing for their children. So that's what's happening here, and we're doing okay. We're feeling fine. We're keeping busy. We're doing a lot of researching, and we'll share whatever we find with those that want to listen. But I do recommend that you look up anything that we tell you about, because there's a lot of stuff out there that is good, and a lot of it is not good. And so we try to find what we think is the truth, and we'll tell you where we got our information from. And if you want to do the research for yourself, which we all should do, to help you with your circumstances, I really would recommend that. And we will continue researching and trying to make our life better And anyone that comes in contact with us, we hope that they will have a better life because we have met them. And we're having a better life because we have met so many of you people. We have learned so much. And, you know, we were at the stage of life where learning wasn't the priority. But I'll tell you now, it certainly is. Because we want to wake up for our health. And on a daily basis, things change.
Mm-hmm.
But we do have some good daily habits going on that we didn't while we were here for the beginning, sort of vacationing. So we're getting back into a routine that we're looking after ourselves and looking after whoever we can. So you have a great day. Look after yourself. Remember, body, mind, and soul are going to make us a wonderful today and a great tomorrow. So we will talk to you soon.
And remember to wake up for your health.
Every
Do
day.
the things that the experts suggest, like washing your hands and keeping your distance and all those things that they're asking us to do. If we all do it together, we'll get through this together.
Right? 3 weeks of us all doing the same thing worldwide would have probably conquered the problem by now.
Mm-hmm.
Anyway, I think we all should be listening to good results and sharing those with people that are in the know and who also want to learn. The doctors in particular, if this is working for one, it'll work for another. But is this going to be allowed to be on TV or on the news? We soon will find out. But I did hear maybe 2 weeks ago about the what this doctor is using that was used for malaria years ago had been working somewhere. So now we've got it in writing from a source that we think is correct and right. I think it's the source,
Mm-hmm.
right? So bye for now. I could go on for a long time because so many things have happened. We do appreciate you being with us, and we thank you for your continued support, and we love everyone. Take care.
Bye now.
Get better.